Welcome to the second international webinar of 2022 organized by Vets and Clinics by Advance. My name is Alba Martos and I'm the International Vet Manager of Affinity Pet Care. And today I'm very happy to be here with Alejandra Garcia. Hi Alejandra, good afternoon.
Hello, how are you?
First of all, I would like to present our speaker today. She's a European graduate in veterinary analgesia and anesthesia, and nowadays she's the head of the anesthesia and analgesia service at the Vet Veterinary Referral Center at Palma de Mallorca. So today we will talk about how to manage the pain in cats. And I would like to remind you that during all the sessions, you can write your questions on the right side on the YouTube screen. And at the end of the session, we will answer the questions we have. And also, if we don't have enough time, below the description of the YouTube, you can see an email direction, and also you can send your questions there, and Alejandra will answer your questions. Also, before starting, I would like to remind you that on the description, you can find a link where you can download the presentation and you will have all the slides you will see during all the session. So I will not delay any longer. As I said, today we will speak about how to manage pain in cats. And Alejandra, before starting specific questions, I would like to ask you why you think that this topic is quite important to share with our audience. So can you give us a brief introduction about that?
Yes, nowadays pain is a growing interest in veterinary medicine. So cats are special patients for us as well. And I think the analgesic management is really, really important for their welfare, even in acute and chronic pain. So I think this talk, I hope you enjoy it. And this is a little bit of the introduction and contents that we are going to talk about. So first of all, we are going to introduce some definitions of pain, and then we will learn how to recognize acute pain and chronic pain in cats and what we can do to assess their pain. And then at the end of the presentation, we will speak about treatments, different treatments that we have for acute pain management and then for chronic pain management, which are a little bit different. So the first thing that we are going to define is pain. So pain is an unpleasant, subjective, sensory and emotional experience that can be found in any living species with a central nervous system. And this experience is associated with or resembling what is associated with actual pain or tissue damage. Therefore, now we know that what is pain, we need to define what is an analgesic. So basically, an analgesic is a drug or a treatment that basically reduces the sensation of pain without loss of consciousness, because that will be anesthesia or no analgesia. Sometimes, especially in anesthesia, we can prevent pain. We can give analgesics before a surgery, for example, to basically try to reduce the nociceptic impulse, to have the efficacy of the analgesic before this tissue damage occurs. For example, if we have an ovary hysterectomy in a cat, in a female cat, we are going to give her an analgesic in the premedication before the actual surgery happens. This is really good because we can try to be more efficacious, and the duration of the analgesic will control the pain and the physiological mechanisms of pain and inflammation before they even occur. So that will be really, really good. In other situations, we cannot prevent it and we just can treat it. Like, for example, a cat had an accident, a road traffic accident, for example, and the cat comes to the veterinary practice, and then we have to treat the pain. So the pain is already there and we just treat it. How we can do that? We can do multimodal analgesia, which will be the best way to do it. This multimodal analgesia is a combination of different analgesics, which they have different effects at various sites of the nociceptive pathway. Basically, they act at different levels of this nociceptive pathway that we will see in a moment. They will have synergistic effects, and they will enhance the analgesic effect and reduce the side effects of each of them. Talking about the nociceptive pathway, what is nociception? Nociception is the physiological process. We have the neurons and afferent activity of the central nervous system, and this pathway and this nociception is basically the physiological process of pain recognition and pain sensation. And then we have another definitions of pain, like hyperalgesia and allodynia, which they happen more in chronic pain states. Hyperalgesia basically is increased sensibility to pain after an injury and persist normally in a chronic way, chronically. And allodynia is pain that appears after a non-painful stimulus. For example, if you stroke your hand, it shouldn't be painful. However, if you have allodynia, this may be painful. So that's another pain state that we can find specifically in chronic pain states. This is a diagram of the nociceptive pathway, what we were talking about. So if you see there are few steps, so we have transduction where actually the tissue damage happens, and then we will have the nociceptors that are in charge of transducing this signal into an electrical signal that it will be sent up all the way up to the spinal cord by a first order neuron. This will be called transmission of the nociceptive input. Then we will go to the spinal cord where there will be a second neuron, and there will synapse there. And then we will have modulation of the pain in the spinal cord. We can have modulation. Also, we can have modulation of the pain all the way up to the brain. And these spots are basically places where the analgesics can take place, like, for example, modulation of pain, transmission of pain, transduction of the pain. And the last step on the nociceptive pathway will be the perception. Basically, you perceive that you are feeling pain, and for the perception to take place, you need to be awake. If you are anesthetized, perception, you won't know that you are having pain. You will have all the nociceptic impulses, and you will have changes on your heart rate, on your blood pressure, on your respiratory rate, but you won't know that you're in pain because you're anesthetized. Okay. Then we will also speak about basically the use of this pain. Why do we have this nociceptive pathway, and why is this all important? So basically, we have to differentiate between the physiological aspects of the pain and the non-physiological or maladaptive pain. So basically, pain is one protective mechanism, basically. So you feel that you are having pain somewhere to be able to protect yourself from that pain if you are getting burned or something like that. Normally, this physiological response is related to the extent of the damage. So it's useful because you know where is this pain and why is it happening, because you're getting burned. Provides information about the location and the duration of this damage. The fibers involved are some fibers on C fibers and delta fibers. This physiological pain, which is actually has some use, is acute or chronic. Normally it's more acute, but it can be a little bit more in time. If the wound is an extensive wound, it could be chronic for 2-3 weeks, for example. And then we have this maladaptive pathological pain. Basically, once all this painful stimulus has happened, something goes wrong in the nociceptive pathway, and we have sensitizations of mechanisms that basically have like an error, and then is when chronic pain is happening. This doesn't have any clinical function, basically. last much longer than the painful stimulus, so you can have chronic pain even when the wound or the damage is already healed. Is referred or extended to somewhere else, can be referred to the, for example, you have pain in the back and you can also have abdominal pain at the same time, which is extended somewhere else. There are other fibers also involved, and it's always chronic. So you can see when you have your pain because it's a physiological and protective mechanism, and something goes wrong, and suddenly you have maladaptive and pathological and chronic pain states. This usually happens when there is a damage, for example, in a nerve, when there is a chronic damage in a joint, for example, in osteoarthritic pain, we can have chronic pain, and other basically non-physiological problems. In cats, we have few examples of chronic pain that don't have any function. For example, urinary kind of problems and facial pain states and other neurological problems that we can find that are related to chronic pain, and they don't have any physiological, basically any physiological use.
Thanks, Alejandra, for this introduction. So now that we know a little bit more about what pain is and what it's the reason for its appearance, why it's so important to treat this pain in our patients.
Basically, pain is something that is not pleasant. So basically, we try to treat pain in a way to look after our patients. This is basically animal welfare. We should try to ensure that our patients are okay. Also has some problems associated with pain. For example, decreased appetite, and our patients don't recover as quickly as we would like from a surgery, for example. They will have disturbed sleep patterns and they will be tired. This is also being reported in people, the disturbed sleeping patterns in people with chronic pain. In cats especially, it will be a decreased grooming, so you will notice that they are not grooming themselves, they're not looking after themselves because they are not feeling good. They spend less time in social interactions with us, with their owner, or with their companions if they live with other cats or dogs. They may have mood changes as well, so the cats are more feisty, or basically they are not like they were before. Especially in acute pain, we can have impaired gastrointestinal motility, and this is also important, and is also related to decreased appetite in these patients with acute pain. And this is something to look after, because when we want to send a patient home after hospitalization and surgery, we need to ensure that they are eating and drinking normally, their gastrointestinal motility is okay, and all of this. And also in people, it's been reported longer recovery from the underlying condition and more days of hospitalization. So this is really, really important for us as vets, and also for the owners and for our patients. So treating pain is really, really important.
Thanks, Alejandra. So assuming that we have to treat this pain and we have to learn how to recognize it, my question is, what are the challenges for both vets and pet parents when we are facing this treatment of pain in cats?
So basically, we have few problems with cats. One is the size of the cat, because some drugs are specifically for veterinary patients, and they are designed for cats, but others are not, especially for chronic pain treatments. And the dose adjustment could be a problem if the drug is designed for people, for example. Also, because of their special behavior as feline, sometimes recognition of pain can be challenging, or because they try to hide it from us. So this recognition of pain can be challenging, especially in chronic pain states. character. Some cats have more stronger character than others, and sometimes the owners or pet parents struggle with the administration of, especially with capsules and pills. So pharmaceuticals try to help vets to modify this and maybe give you chances to get instead of a pill, you may have liquid form and things like that. Because the character could be sometimes difficult to manage with this pill administration in cats. Other things that we need to have in mind is the metabolism and elimination of drugs are not the same as in dogs, in cats, and this applies to the drugs and the pharmacology of these analgesics. Some of them can be toxic at high doses, or just toxic because cats cannot metabolize them and eliminate them properly. Another concomitant diseases that especially older cats may have, like kidney disease, hypertension, cardiac disease, may limit us basically how many approaches in our multimodal analgesics we can use if they have kidney disease or cardiac disease. If we try to assess pain in non-verbal patients, because obviously the cat cannot tell you where it's painful, basically we need to be very careful and very quick recognizing these specific behaviors that they show you. Each individual is also different, so it's not for all cats will be the same, as pain is not the same for each person. It won't be the same for each cat. So every individual is different depending on breed, age, and many other things. Fear and anxiety can mask signs of pain as well. If the cat is after a surgery is all day under the bed, hidden, so it's really difficult to assess their specific behavior of pain. Postoperative sedation complicates assessment, especially in hospitalized patients where we have to sedate them, for example, to do wound management or something like that. It complicates assessment. Comorbidities as well can be misinterpreted as signs of pain. And also the one drug at one dose specific for cats, it may be different from one cat to another. So for one cat, ketamine will be good, and you can give ketamine to treat chronic pain in a cat, and for the other one, it will be the cat will be dysphoric, and the dose is not well adjusted, or basically the drug is not good for this patient. But anyway, always, if you are in doubt that your patient is painful, we should give them a trial and give them an analgesic and try different combinations to treat pain, because we have seen before that this is really, really important. So acute pain is a little bit easier than chronic pain assessment. Pain should be assessed as part of the physical examination of any hospitalized patient or any patient in the consult. We should try to observe the behavioral changes that they will show us when they are in pain. Obviously, we will do a physical examination, a complete physical examination, and we have pain scales designed for feline patients. The staff looking after hospitalized patients should be trained in pain recognition. It should be one thing to do in each hospitalized patient in their kennel sheet. It should be somewhere in there, pain assessment or pain scale to do in every patient. The value of these pain assessment tools is to guide the clinical response to analgesics when they are in pain, to assess before and after administration of an analgesic, and to monitor analgesia during, for example, postoperative period after surgical treatment. So how do we do it? Basically, we have physiological changes, for example, in the respiratory pattern, in blood pressure, in heart rate, and we can measure cortisol levels, for example. There are some behavioral changes like increased vocalization or purring. Cats can purr also when they are in pain. reduce level of activity, anorexia, avoid physical contact, or even avoid the physical non-painful contact with the owner. They hide, increase respiratory rate again. So, but however, they are a little bit non-specific. So there has been a lot of research, and there are pain scales that can be used for cats. They are unidimensional or multidimensional. Unidimensionals are the simple descriptive scale, numerical scale, and the visual analog scale. However, they have their limitations because they are a little bit, we will say, not very specific. And multidimensional pain scales, we have few examples for cats. For example, you have here the Colorado State University pain scale, where you can see little pictures of the cat and with some features there. However, it's not validated. We will speak about what is validation. So basically, validation is when a veterinary student, a veterinary nurse, veterinary surgeon, they will, for example, evaluate the pain in this cat, and they will all get more or less the same number of pain, the same number of the scale and the number of pain, we'll say the rate. If it's validated, means that it's kind of more repeatable and better, because the pain can be assessed by different people. You're not going to be always there to assess the pain yourself. So, for example, someone will take another shift, and this animal needs to be assessed. Therefore, these scales are very useful if they are validated. The first example that we have is the UNES Botucatu pain scale. It has some things that also evaluate posture, comfort, activity, attitude, behaviors. It's really, really complete. And there is a longer version, that is the one that you have here in the next slide, and shorter version, which is clinically is a little bit more useful. The longer version is really, really good for research. However, if you are doing a clinical examination in your practice, maybe the shorter version will be best because it's quicker. Here is the image of this scale. You can download this scale from their website, and as you can see, they evaluate a lot of things, and then you can have a total score of 30 points. There are some instructions where it tells you when you should rescue your patient if they need extra analgesia. Basically, if you get a score higher than 7 over 30, then that means that your cat is in pain and you may think of giving a rescue analgesic. So this is an example of a cat which is not happy. Look at her posture. She's licking the lips. She is swishing the tail. Rapid respiratory rate. We can see also her well, you cannot hear it, but she was vocalizing as well. So there are a few things that this cat is telling us that she's not happy at all. So if we go step by step doing this Botucatu pain scale, we will get a score. And as I have said before, if it's higher than 7, we should try to think about giving a rescue analgesic. Then, as I said before, also there is a lot of research into these pain scales, and the feline pain phase has been one of them. Basically, this has been now introduced into another pain scale, which is the University of Glasgow pain scale. They evaluated, as you see, lots of points, and they found that the position of the ears, the position of the whiskers, and the tension on the muscle of the mouth, were signs of our cat being in pain. So this is now included into this pain scale, which is the Glasgow Composite Measure Pain in Feline Patients. This is really clinically is really useful. It's quite easy and quickly to be performed. Always you have to first observe the cat in the cage without any interaction, and then you will interact with the cat gradually. You will see also that you have many points, and then at the end you should reconsider analgesics if you get a score higher than 5/20. In this scale you have 20 points. We can I can show you some examples of this scale. So for example, this cat was a cat who suffered fall from high altitude, so he had few fractures, and when he came in he was not happy at all. So we assessed him when he first came to our practice, and as you can see, the ears are completely lateralized, and his mouth was tense and his whiskers were completely at the back. We had to sedate him for x-rays. We gave him methadone, and afterwards I will show you a video of him much happier. Okay. Then there is another group of investigators that are doing a lot of work in feline pain recognition. They also have an app on your phone that you can assess the pain on your cat with your phone. It's the feline grimace scale. This is from Canada. They also noticed that the position of the ears was important, the orbital tightening of the eyes, tension around the muscle, position of the whiskers, and position of the head related to the body. So you can find a lot of information in this website. If you want to go ahead and click, you will find a lot of information. And it's this training of the feline grimace scale sheet. You can download it from internet for free if you are interested, and there is training on how to assess it with images and everything, and I think it's really, really useful. This is all for acute pain in cats. So in this cat we can see this was an example of a cat post-operative surgery, or I think it was abdominal surgery, yes. And she was quite happy interacting with us. However, when we go and palpate around the surgical area, she wasn't that happy. Gentle pressure, and then she marks you with the mouth like, hey, stop. However, we only got number 3/20 for example, in the Glasgow pain scale for cats. So she was happy with her pain medication. This is an example of the interaction with the cat. And this is the cat from before, the one who fell from a high altitude. He had a fracture in the radius and ulna, which we did a bandage, and he wasn't happy with the bandage, but as you can see, he is happy to interact with us. His ears are now in more normal position. His whiskers and his mouth is also less tense, and he was much happier with his pain management right now. However, if we go to the painful area, he does a couple of things that tells us that, hey, don't touch that. The first one that he does is to lick his lips. Let me show you the video again. This is an edited video in slow motion, so you can see. Well, the first one is the facial assessment. So ears are not tense anymore, whiskers are all the way to the front, and the muscle tension is not as it was before. Then when we are approaching to this painful area, what he does is licking his lips, and this is one thing that can is telling us that he's not as comfortable with us touching the painful area. And also he growls at us when we are closer to this place. So therefore, he is a really nice cat. He is not a feisty, aggressive cat. He's a nice cat, but he's telling us that where you're touching me, I am not liking that. Okay, so so this is an example of using these pain assessment tools in acute pain. Chronic pain is another story. Chronic pain is more difficult to assess. And however, it's really important to treat chronic pain in cats. Their increasing life expectancy in general of pets is higher. And also we, as owners, we increase the awareness of pain and we notice the cat cannot jump as much as he used to, for example, or he is having problems to go to the litter tray, other kind of chronic pain states that we can find, and they impact on their quality of life and behavior of these geriatric cats, and especially the relationship with their owners may change. So this is a really, really important thing for vets to be there to help the owners and the cats to get better. And the one who is going to be the key in this is going to be obviously the cat and the pet parent. So they play the key role, because you as vets, when they bring you this geriatric cat to the practice, is going to be scared, is not going to be jumping over places that he used to jump, and all these subtle changes. The best one who is going to be able to assess the chronic pain state is the pet parent of this cat. We need to obviously take a full medical history. We need to obtain information regarding when they started these symptoms, the previous diseases of these cats, mobility, if they are not able to jump where they used to, the activity and the hours that they sleep each day, feeding and drinking habits, and if there has been a change in that, grooming and scratching and claw sharpening, and if they have mood changes, for example. This is really important. We should perform an orthopedic and neurological examination and palpation of the painful areas. We should try to do some laboratory and imaging and diagnostic imaging tests. If we find something like, for example, osteoarthritic cat, then there are a few scales that are specifically for cats with chronic musculoskeletal pain. However, if it's something different, like neurological or other type of pain, they are not as specific pain scales, and they are, for example, quality of life questionnaires for cats. Basically, this is the owner who has to fill a questionnaire, and it will give us basically an idea of the quality of life of this patient, and then we can use these tools to administer a pain medication, a painkiller, and then see the response to this medication with the owner.
Thanks, Alejandra. So I think that it has been a detailed explanation about how to assess the acute and the chronic pain. So now I would like to move to the therapeutic tools. So I would like that you share with us your experience and your knowledge about which therapeutic tools we have to treat the acute pain.
Good. So basically for acute pain, we have more tools. We have different drugs, many drugs. So for example, NSAIDs and opioids are the base of the acute pain treatment. Then we have in really painful patients, we can have variable rate infusions like fentanyl infusion, ketamine, alpha-2 agonist, and obviously local regional anesthesia. And this is for acute pain management. Then routes of administration, we have different routes. We have, of course, intravenous, intramuscular, transmucosal in cats works really well, oral, and then we have different manners of administrate a drug for bolus, infusion, epidural or wound catheters, etc. So for acute pain, we have lots of tools of drugs and routes of administration. For example, opioids for acute pain management, we said, is one of the most important analgesic that we have. Normally, if it's a moderate to severe pain, we can use pure mu agonists like morphine, methadone, pethidine, fentanyl, any of those. They provide sedation, but they can provide dysphoria if you give too much. They can produce bradycardia because they increase vagal tone. They can have respiratory depression, and basically their metabolism is through the liver, hepatic metabolism, and they can cause nausea and vomiting, especially morphine, because depending on how quickly they cross the blood-brain barrier, they may cause some nausea and vomiting. So this is one thing to take into account when we give opioids to a cat. And then we can have also kappa agonists and mu antagonists. They like butorphanol basically. However, this opioid is only for not very severe pain, basically moderate to non-painful procedures, because it's better sedative than an analgesic. It's true, we use it a lot for sedations and for minimal painful procedures or diagnostic imaging. It causes minimal respiratory depression, and it has basically antitussive effects. It has short duration of action and can be used to reverse respiratory depression after administration of pure agonists. However, the analgesic effect of butorphanol is very limited. Regarding partial agonists, the buprenorphine, it works really well in cats. It causes mild sedation, but has long-lasting action, 6 to 8 hours. It has high affinity for the receptors, but it has a ceiling effect. So it's for moderate pain. If it's really severe pain, buprenorphine may not be enough. It has seen in some studies as that subcutaneous administration of normal buprenorphine has erratic absorption and may not be as effective as, for example, intramuscular or intravenous route of administration in cats. And you have here the publication where they saw that.
Thanks, Alejandra. Regarding this last slide, you have talked about different routes, but I have the doubt about the transmucosal route. So we can use this one for cats?
Yes, buprenorphine may be administered transmucosally in cats, and it has high analgesic efficacy comparable to IV administration, even if there is an inflammation of the mouth, like for example gingivostomatitis in cats with chronic gingivostomatitis is still being absorbed. However, the formulation for transmucosal delivery must be without excipients. It should be excipient free. So not the bupac or the multi-dose vial, because otherwise these excipients, they won't be, the preservatives, they may have bitter taste and the cat may not like it. So if you want to ensure that it's well tolerated, the buprenorphine should be excipient free. So another important drug that we are going to speak about regarding acute pain and also chronic pain management are the NSAIDs. NSAIDs in cats, basically we have here a table with some examples. There are many of them. They have anti-inflammatory, antipyretic, and analgesic effects. And they basically can be given depending on the drug for 5 days, 3 days, or even in chronic pain states, we can also use NSAIDs. However, they have side effects. Basically, the side effects of the NSAIDs are at the level of the kidneys. We have loss of autoregulation during hypovolemia and hypotension. So I like to give NSAIDs if I am going to use them after anesthesia, when the animal is fully recovered, hemodynamically stable, and is being on fluid therapy and after anesthesia when he's recovered, not with the pre-medication, because I never know which cat is going to be hypotensive or hypovolemic if they bleed during anesthesia. So I like to give them at the end of the anesthetic when they are already recovered. If they have kidney failure, basically we have to be careful with NSAIDs. We will speak about that in a second, but basically if they have a kidney problems, we have to be a bit careful with NSAIDs. Regarding hepatic metabolism of these drugs, there is no evidence of liver disease or any problems with NSAIDs in cats. And you know that they have limited glucuronidation, but basically if your cat is not in liver failure, you're okay to give NSAIDs to these cats. Regarding gastrointestinal problems, obviously GI irritation or gastric ulcers are not proven in cats, but we can see vomit due to the administration of NSAIDs. And basically that's another thing to consider when we have a cat that is already vomiting. Look after, take care with the doses or the drugs that you are administering on how long. Regarding coagulation problems, it's true that some of them can be they have anticoagulant properties, for example aspirin. If your cat has a coagulation problem, then again take care with the doses, or if you are actually going to give an NSAID to this cat. However, if the coagulation is normal, then you are safe to use them. Ketamine is another tool for pain management, for acute pain management. Ketamine acts on receptors that are basically the NMDA receptor. And basically what ketamine does is an excellent analgesic and sedative, prevents central sensitization thanks to this NMDA antagonist effect, and prevents neuropathic pain states. I like to use ketamine when I have like an orthopedic, like for example, a fracture in a cat or a neurological problem like spinal surgery, basically something involving bones or neuropathic pain. Then I like to give ketamine for during surgery or for induction, for example. I like to use an infusion, a constant rate infusion of ketamine during surgery in these patients because of this preventive of neuropathic pain. However, ketamine also has side effects. For example, agitation and recovery, muscle stiffness, salivation, and other side effects that we can find with ketamine. Regarding ketamine in cats with heart problems, you have to know that ketamine is a sympathetic stimulative drug, and it can cause tachycardia. It's a negative inotrope in animals that are in shock. If you have a cat with a hypertrophic cardiomyopathy, you should avoid it. Or if you have problems like intracranial problem or intraocular pressure problem, then I should try to avoid ketamine in those cases. Alpha-2 adrenergic agonists like medetomidine, dexmedetomidine are really good analgesics as well. They provide sedation, muscle relaxation, and I use them basically almost every day. However, they have side effects. They cause cardiovascular depression. First, they can cause bradycardia, and they are pro-arrhythmogenic. And then after this initial bradycardia and hypertension, after 15-20 minutes, then you will have hypotension because of decreased cardiac output. So again, if you have a cat with a heart problem that is almost in heart failure, then you should try to avoid alpha-2s. It also causes diuresis and hyperglycemia. So side effects of each drug, that nothing comes for free.
Thanks, Alejandra. So, well, you have told right now about the drugs that can be useful in cats for treating pain, but I want to ask you about the ones that don't work. I mean, the ones that we shouldn't use in cats.
So, because we tend to extrapolate from dogs, which analgesics we shouldn't use or they don't work as well in cats. Basically, in dogs, sometimes we use lidocaine as an intravenous infusion. In cats, is effective as an antiarrhythmic if you have a heart problem with arrhythmias, but is not good as visceral analgesic in cats, which is for dogs. So again, think twice about giving lidocaine IV as a constant rate infusion for treating pain, because that doesn't make sense in cats. Metamizole or magnesium dipyron is an analgesic, but has not yet been proven in cats. So it's not toxic. You can give it. You can give it as an antipyretic. However, its analgesic effects are still not being proven in cats. In dogs, it has some analgesic effects, but in cats, it's still there. Paracetamol, no, it's really toxic in cats because they cannot do the metabolization in the hepatic pathway. Therefore, it causes hepatotoxicity, liver failure, and multi-organ damage, and basically meta-hemoglobinemia, and you can kill the cat if you give them paracetamol. So no. And then maropitant, which it was thought to be a really good visceral analgesic, it reduces MAC, but has no anti-inflammatory or analgesic effects proven still in cats. So still to see if we can use these drugs or not, some of them. For the treatment of chronic pain, as we said before, it's harder to detect than treat. Treatment is always multimodal. We will use combination of drugs, diet, and weight control. Super important in cats, in obese cats, to control their weight. And also we will try nutraceuticals with their food, or we can give them afterwards. But that's another tool to explore, as well as physiotherapy, acupuncture, and other things. For chronic pain treatment, we said that we could use NSAIDs in cats. And nowadays, the one that is being described is meloxicam for use, long-term use, at a really lower dose than the one that we will use for acute pain.
Thanks, Alejandra. So, well, after revising all the a global picture about the drugs that we can use to manage the pain, I suggest now to deal with the real situation. For example, imagine that we have a senior cat with osteoarthritis and also somehow an onset of a kidney disease. So, which drugs we can give to this patient, and which is your recommendation for that?
So this is a common, actually, a common situation, a common clinical situation, that we have a cat which is, for example, hip dysplasia or basically osteoarthritis, and they also have chronic kidney disease. So regarding the use of NSAIDs, we said that we had to be careful with NSAIDs when they have kidney disease. However, there is this article which speaks about the long-term use of non-steroidals in animals with stable chronic disease. So basically, the aim of giving a non-steroidal is to improve the quality of life of this patient with obviously the minimum dose possible of meloxicam, to be able to treat the pain but not damage their kidneys. So they suggest that we could try to give meloxicam at these doses in stable cases of iris, for example, 1 to 2, or in stable cases of chronic kidney disease, with a compliant owner that is able to bring the cat for their checks of creatinine, body weight, no hypertension, basically bring the cat regularly to the practice to check all these kidney disease and also that is not worsening because of the use of the NSAIDs. Other things that we can tell the owner is to the cat needs to have constant access to water, for a diet that is for renal disease with phosphorus control diet and kidney diet basically, and the important is the follow-up. So the owner also needs to be aware if the cat starts with vomiting, weight loss, or increased polyuria, polydipsia, then they should bring the cat to the practice to check that everything is okay. This follow-up should be done every 3 to 6 months after starting this treatment with NSAIDs in a chronic kidney disease patient.
Thanks, Alejandra. So, well, now you have been talking about NSAIDs. So let's move to an opioid, which is Tramadol. And the question is that how effective is this drug for treating pain in cats, and what its limitations are?
I put Tramadol here in chronic pain states, not in acute pain, because I like it for chronic pain more than for acute pain management. Tramadol is, as you said, a synthetic mu opioid agonist, but is 10 times weaker than morphine, and also has other mechanism of actions like anti-serotoninergic and noradrenaline reuptake inhibitor. So this drug has three mechanisms of action. The most important metabolite of Tramadol, once you have it orally, is the metabolite M1, which is O-desmethyltramadol, and in cats has good bioavailability after oral administration. The dose of Tramadol to get a reasonable amount of the M1 metabolite is 2 to 4 milligrams per kilogram every 8 hours. So it's been described to have reasonably good efficacy in chronic pain, however has adverse effects like nausea, agitation, or dysphoria. So we have to move basically with these doses to try to reduce the side effects but get good efficacy for chronic pain treatment, and it's actually more effective in cats than in dogs. And basically the limitation of Tramadol is the palatability. It's the bitter taste that cats don't like this poor cat that has lots of salivation after administration of an oral medication. Then there is tapentadol, which is a newer drug, kind of the same mechanism of action of Tramadol. It's an atypical opioid like Tramadol is, and also noradrenaline reuptake inhibitor, but does not act on serotonin receptors. Its effects are due to the drug and doesn't need the active metabolite to work. Increase the thermal threshold in cats after oral administration, and the dose is higher than in Tramadol. So it's another option that is getting explored. Also causes salivation, agitation, and panting, like Tramadol can cause. But it's another tool and a newer drug to try.
Thanks, Alejandra. So let's move. Just is the last question about another drug, which is gabapentin. So my question is about if it's useful for treating both acute pain and chronic pain in cats. So can you give us your opinion about this?
So gabapentin is basically gabapentinoids. They block central sensitization and they bind to the calcium channel of the central nervous system of this receptor. So they basically in acute pain states, their effectiveness is not being proven, but it's because their effects take place later. So you need at least 1 week to 10 days to see an effect from this drug. So in acute pain, obviously, it's really difficult because acute pain shouldn't be that long. So which is recommended for chronic pain states is to give a trial of 1 month to observe the effect. Gabapentin is the one that is being used the most in veterinary patients. It produces some degree of sedation. The dose, you have it there. And nowadays there is also a pre-drug of gabapentin, which is pregabalin, which still there is not a lot of information for cats available, but it seems also promising in dogs. So hopefully we have another tool here. So for chronic pain states, especially for neuropathic pain, yes, definitely. For acute pain, not that useful yet. So in chronic pain, gabapentinoids appear to be effective for the multimodal treatment of chronic orthopedic pain, and especially in cases of allodynia and hyperalgesia. And there is a single case study of pregabalin, but they had good results as part of multimodal pain treatment, especially in neuropathic pain. So that's one thing to take into account. Other treatments, just to finish, for chronic pain is amantadine, which is an NMDA antagonist drug like ketamine. Also requires effective dose of at least 2 weeks trial to know if this drug is working or not. However, it needs because it's a human capsules, human dosages, we need to reformulate for the correct dosage for cats. However, has renal elimination, and if in cases of chronic kidney disease, we need to reduce the dose or the frequency of administration. The side effects could be also agitation and diarrhea. That's another side effects. And then there is amitriptyline, which is a tricyclic antidepressant drug. Also needs at least 2 to 3 weeks for trial to know if this drug is working in your patient. Inhibits noradrenaline, serotonin, and dopamine. And then you need to be careful if you are giving any other drug that inhibits serotonin reuptake, like Tramadol, for example, to make sure that you are not causing a serotonin syndrome or anything like that. And diet, it's really, really important. The diet, we spoke about it. There are some nutraceuticals that can be included to the diet, like omega-3 fatty acids. And this has been reported to improve the quality of life of these patients. Other drugs like chondroitin, glucosamine, and other nutraceuticals can also be included to preserve joint cartilage and the muscle mass. Basically, this everything that we can do to improve the quality of life of our patients is really, really important. So in conclusion, the recognition of pain in non-verbal patients is complicated and depends on the species and the individual. We should anticipate the level of pain according to the procedure to be performed, treat the patient preventively, and also for monitoring, we should try to assess the pain. And always, if you are in doubt, administer an analgesic. Thank you very much.
Thanks again for being here with us, Alejandra, and thanks for the presentation. It has been really, really interesting. So we have received a lot of questions during the session, and I encourage all our attendees to be connected because we will come back in a few minutes. We are here again, so thanks for being connected. Before starting with the questions, I would like to remind you that below in the description of here on the YouTube screen, you will find a link, and there you can download the presentation of Alejandra. So Alejandra, we will start with the first question. The first one, it's about Metacam, and the question is related about if after a parenteral dose, how much time do we have to wait until we continue with the oral administration?
So we can give, for example, one dose subcutaneously, and then basically meloxicam is given every 24 hours. So basically 24 hours until the next administration. That could be oral or subcutaneous or whatever. So I normally, when they are during the day doing surgeries, I tell the owner when the dog goes home to give it the next day at after midday, for example, and that's it. So they know more or less when to give the oral dose.
Thanks. The second question, it's also about drugs, but related with another one, amantadine.
Mhm.
Well, we have seen that it's useful for the treatment of chronic pain, but the question is that if it's also useful to treat the acute pain.
With amantadine, is a little bit the same way like gabapentin, because amantadine needs to be given at least 7 to 14 days to see an effect. It will be kind of the same for acute pain. It's not that it's not useful, it's difficult, really difficult to know if it's actually doing something because we need to give it for 14 days. So for acute pain management, I think instead of giving amantadine, you have, for example, ketamine, which has the same mechanism of action and is really quick. The action time is really quick, so then you can give ketamine instead. And if you want to continue giving an MDA receptor antagonist when he goes home, then you can prescribe amantadine and just give it home after that.
Okay, thank you. And the last one, it's it's a question about the not the drugs, but also about the treatment. And the question is related with application of local cold or heat, if they can also work with analgesics, and also the use of omega-3 fatty acids, since we know that they are, they have an anti-inflammatory effect. So how we can manage these other options in combination with analgesics.
Mm-hmm. Applying especially cold patches around the painful area is a really simple technique, and is helpful when there is inflammation, for example. In horses is done almost every day, and in small animals when they are hospitalized and they have a lot of inflammation next to the surgical area, that also is helpful, especially because cold decreases pain sensation. So that's actually a good thing to do. Hot compresses, for example, are given afterwards when there is a muscle tension or something like that, or a neuropathic kind of pain. Then we can apply hot compresses, for example. And use of omega-3 fatty acids is being proven in dogs for sure. That is helpful, as you said, as anti-inflammatory effect. And I think in cats it's the same. So it's easy, simple to give, and it's helpful in chronic pain states like, for example, osteoarthritic pain.
Thanks, Alejandra. So now we are at the end of the session. We do not have more time. So thanks again for being here. And thanks all people that have been connected with us. So I hope you have enjoyed the session, and I hope I see you in the next webinar next month. Thank you very much.
Thank you very much. Bye bye.
Bye bye.